Hello, my name is Katie Sherlock and I'm the occupational therapist here at the Hoag Orthopedic Institute. The purpose of this video today is to discuss how to safely care for yourself after shoulder surgery. After shoulder surgery, the most important thing is to avoid actively using your shoulder muscles. We don't want you to tighten or shrug or lift your arm at this time during the recovery process. In order to get dressed, you'll need to reach underneath your arm. In order to do that, lean forward slightly at your waist in order to reach. In order to get dressed, there's a few things to consider that make it a little bit easier. First, it's easiest to use a button-down, loose-fitting shirt. You also want to have elastic waist pants that will be easy to get on and off. It's difficult to tie your shoes with one hand as well, so it's nice to have shoes you can slip into. It will make your life a little easier. In order to get dressed, the first thing we're going to do is take the brace off. There's a separate video that goes through how to take your brace off and to put it back on. I'll take the brace off. Once the brace is off, we're going to dress the affected side first. So you'll take your shirt with your good arm, bring the sleeve up your affected arm, and bring your other arm around and in. It may be helpful for the first few days to have help buttoning your shirt. To take it off, we do the reverse. Get your arm out, pull it down the affected arm. In order to bathe yourself, you can again lean forward slightly at the waist and take the washcloth underneath your armpit. It's more difficult to wash under the non-surgical side at this time. What I suggest is to hold the corner of your washcloth, toss it underneath, and pull it through. Because you're down to washing yourself with one arm, there may be places you can't reach. So it's very helpful to have some kind of a long-handled sponge or scrub brush in order to reach the places you can't with just one arm. The next thing I'd like to do is to discuss with you a few other things that will make you safer at home after your surgery. Let's talk about a few things that you can do to make you and your home ready and safe for you after shoulder surgery. The first thing that comes up is how much help will you need after surgery? Some people need assistance with bathing and dressing for the first couple weeks after shoulder surgery. Others are able to manage a little easier by themselves. For sure though, you'll need help with driving. You'll need help with some of the heavier tasks around the house, taking out the trash, doing the laundry, some of the things that take a little more work. One thing you can do to prepare for after the shoulder surgery is to have some meals prepared ahead. Have them prepared in something simple to get into. Another thing you can do is have scissors around the house. It helps to open containers or open your mail, whatever it is that you need. You also want to make sure that any trip hazards are up and out of the way. Any throw rugs that are on the floor should be picked up. You don't want to catch your foot and trip on anything after shoulder surgery because a fall could cause a lot more damage. When you go to the bathroom, you want to start practicing reaching with your non-surgical side to wipe yourself, even if this isn't your dominant arm. You also want to make sure that the toilet paper is someplace that you can reach easily. When sleeping, a lot of people prefer to use a recliner to sleep in after shoulder surgery. If you don't have one or you don't want to try this, it may be more comfortable to have a few extra pillows around so that you can sleep at an incline after shoulder surgery. It's also helpful to sleep on your good side, towards the good side of the bed, so you can get in and out of the bed a little easier. The best thing that I can suggest to prepare for your shoulder surgery is to practice doing things with one arm. Some people have even strapped an arm to their body and gone through a day, just to see what kind of things are going to be difficult and problem solve these. Thanks for your attention. I wish you the best of luck with your shoulder surgery. I look forward to meeting and working with you and addressing your individual concerns in the hospital after surgery.